Good evening, everyone. So we will continue our lecture series on dermatopathology, and this week we will be discussing granulomatous tissue reaction pattern. Now, in the previous weeks, we have discussed the lichenoid tissue reaction pattern, and prior to that, we discussed how a normal epidermis and a normal dermis looks under a microscope. I hope that you are finding these lectures useful and you are utilizing things that you learn while you are analyzing the biopsy reports or the slides if you are able to see them under a microscope. Now, granulomatous tissue reaction pattern is a bit different from a lot of other reaction patterns in the very important way that it is very haphazard. A very haphazard, I mean by haphazardness is that a lot of different kind of disorders come together in the grand umbrella term of granulomatous tissue reaction pattern, and that is because a granuloma is a collection of inflammatory cells. And depending on the type of cells that constitute the granuloma, you see a different type of patterns or different type of granulomas in different disorders. And because of that, the diagnosis or actually clubbing the different skin disorders in a certain section under the granulomatous tissue reaction pattern makes it a bit difficult. So what I have done in this lecture is that I've tried to analyze or actually explain how a granuloma forms, what are the different types of tissue reaction patterns under the granulomatous term, what are the different granulomas that form, and the disorders in which we see those different granulomas. Additional to the collection of inflammatory cells, we see different types of multinucleated giant cells. So I've decided that I'll also mention what kind of giant cells we predominantly see. Now remember that even if we have prototypical reactions or prototypical disorders, for example, in sarcoidal granulomatous reaction pattern, we do have sarcoidosis, which is a prototype of that disorder. You can have different types of granulomas in a single slide, but you just have to look at the major pattern of granulomas that are there in the dermis. Okay, since this reaction pattern is predominantly situated in the dermal portion of the slide, nearly everything is happening in the dermis. But we have to keep into account what are the changes that we see in epidermis in order to make a complete diagnosis. But the extent of this lecture would be just to find out how we can identify different type of granulomas and different types of reactions that we see in the dermis while we're analyzing the slide in which we see this type of tissue reaction pattern. Okay, so slowly and slowly we'll study about the different granulomas, and without much further ado, we'll start our discussion on granulomatous tissue reaction pattern. Granulomatous inflammation or chronic granulomatous inflammation is the mainstay of the disorder which is happening. That means you see a lot of inflammation and a lot of granuloma formation. So that is what is happening in the background. Now, this inflammation is characterized by localized collections of epithelioid cells. We will discuss what are epithelioid cells, and they have a lot of mixture of giant cells and inflammatory cells like lymphocytes. You have the plasma cells, fibroblasts, and non-epithelioid macrophages too. Okay, there are five histological types. In fact, there are more than five types, and we will be discussing them further in the lecture. Okay, there are more than five types, but predominantly the five types are sarcoidal granuloma, tuberculoid granulomas, necrobiotic or collagenolytic granulomas, suppurative granulomas, foreign body granulomas. Apart from that, you have a final category which is miscellaneous, in which you see a different type of architecture of granulomas, and it is very difficult to put the category of miscellaneous into the initial five types. So, as I've said in the previous slide, that you can have different type of architecture, different kind of pathology, different kind of granulomas in a single slide. So, what we will do is we will analyze the formation of granulomas in each of these five histological types, and we understand what are the differences between them so that when we are looking at a slide, we can easily recognize whether it is a sarcoidal granuloma or a tuberculoid granuloma or a suppurative granuloma. So we'll keep our focus on finding out what type of granulomatous tissue reaction pattern are we dealing with. So with that, let's start our discussion on granulomatous tissue reaction pattern. So in order to understand granulomatous tissue reaction pattern, we need to know what exactly is a granuloma. Okay. So granuloma is a discrete collection of histiocytes. Remember what are histiocytes? Histiocytes are nothing but macrophages, but they have decided to stay in the dermis. So they are resident macrophages or fixed macrophages. They reside in the tissue, and that is why they are known as histiocytes, because we know that histio means tissue and cytes mean cells. So cells residing inside the tissue is histiocytes or epithelioid histiocytes. Now, epithelioid histiocytes are histiocytes which show characteristics under a microscope which are similar to those of epithelial cells. That means they are flatter, they are pale staining. So these kind of characteristics led to a separate term of epithelioid histiocytes. But these are just histiocytes which have been activated by the immune system to form a granuloma, okay, or a inflammatory reaction. Now, a granuloma is a discrete collection of histiocytes or epithelial histiocytes with variable numbers of multinucleated giant cells. Okay, so there are different types of giant cells along with the collection of histiocytes and other inflammatory cells, namely lymphocytes, macrophages, epithelial cells, giant cells, and plasma cells, and a various mixture of different inflammatory cells. So just remember, granulomas are collection of histiocytes with multinucleated giant cells with inflammatory cells like lymphocytes, macrophage, plasma cells, etc. But predominantly, it's the lymphocyte which is the main inflammatory cell inside a granuloma. So here you have a histiocyte. We have discussed what a histiocyte is the morphology of histiocyte in the lecture on dermis. Okay, so and histiocyte when it becomes much more paler in look in under a microscope, it looks a bit paler. It looks a bit light pinkish, and the nucleus also changes, which is termed as a slipper-shaped nucleus. Okay, a slipper-shaped nucleus. So the nucleus looks like a slipper. Okay, so if we can, like the sole of a slipper or the undersurface of a slipper. So that's how a nucleus looks like. So these are known as epithelioid histiocytes. Okay. Now, most of the time, the epithelioid histiocytes, this is also in conjunction with another epithelial histiocytes. So all of the same in a granuloma is a collection of epithelial histiocytes. So a lot of epithelial histiocytes will be together, and they will be so much together that you cannot distinguish between one cell as compared to another, and you will just see this slipper-shaped nucleus. So in a slide, wherever you see collection of slipper-shaped nucleus, remember that it's a collection of histiocytes, or to be correct, epithelioid histiocytes. So let's see how a granuloma forms. So there's an antigen which is not properly cleared by the immune system, and in order to sequester, in order to kind of catch the antigen or just to make some kind of walls around the antigen, the granuloma is formed. So granuloma is just a reaction pattern against an antigen which is not properly cleared by an immune system. So you have an antigen and then you have histiocytes which are modifying each other. These histiocytes will then call different types of histiocytes which will surround the antigen. Okay, so different histiocytes will come and they are going to surround the antigen and will have a collection of histiocytes. Okay, and why are they forming a collection around an antigen? That is because they are activated by inflammatory cells, namely lymphocytes. So surrounding the granuloma, you will often see a rim of inflammatory cells, and as we have said previously, the rim is most commonly made by lymphocytes. So in a granuloma, you will have a lymphocyte rim. Okay. So from center to outwards, you will have antigen or any substance which the immune system is not able to clear properly, surrounded by modified histiocytes or epithelial histiocytes, and then after that you will have a rim of lymphocyte. So this is how a granuloma is formed. Okay, so you will have antigens, you have a epithelial cells and a rim of lymphocytes. And some of the lymphocytes can also be present inside. Okay, so granulomas or the granulomatous tissue reaction pattern is made up of granulomas. Okay, Now, what are the different types of granulomas? So, pathologically, they have been divided into these categories, which is tuberculoid, sarcoidal, collagenolytic, suppurative, foreign body, xanthogranulomas, and miscellaneous, which have features going to different categories, but not you're not able to put them into one separate category. Okay, so let's discuss each type of granuloma separately, and let's start our discussion with the tuberculoid granuloma. In tuberculoid granuloma, we will see a significant rim of lymphocytes. So here you can see that the modified epithelial cell are surrounded by a lymphocytic rim. So this is lymphocytes. Okay, so there's a rim around the epithelial cells which is made up of lymphocytes. That is known as the rim of lymphocytes. There may or may not be caseation necrosis. Okay, so what happens is when a granuloma grows very large, the cells which are at the center of the granuloma, they undergo necrosis. Okay, they're going to die, and that necrosis is sometimes seen in slide. It may or may not be present. If caseous necrosis, or by caseation we mean cheese-like necrosis, is seen under a microscope, then it goes more towards tubercular granuloma. But for a proper diagnosis of tubercular granuloma, you need to see the lymphocytic rim. Okay, you need to see this lymphocytic rim. Along with the tubercular granulomas, you will have a special type of giant cells known as Langerhans type giant cells. Okay, so in Langerhans type giant cells, you will have giant cell, and since it's a collection of different cells which have come together to form a giant cell, you will see multiple nuclei. Okay, but you will see that the nucleus are at a pole. That means they are not at the center of the giant cell or haphazardly or randomly placed inside a giant cell. They are more towards one side as compared to the other side, and that is the morphology of Langerhans type giant cell. Just remember, it is Langerhans, it is not Langerhans. That's a different cell. It's Langerhans type of giant cell. So in tuberculoid granulomas, the granulomas are less circumscribed. That means uh, they are not so discrete. Okay, the boundaries are a little bit fuzzy as compared to the sarcoidal group. There is greater confluence. By confluence, we means that they are kind of they are together. The granulomas are together. Okay, they are not they are not separate or discrete that we see in the sarcoidal granulomas. They are together, and they have a substantial rim of lymphocytes with occasional plasma cells. Now, these granulomas have additional Langerhans giant cells together with them, and you may or may not see caseation necrosis. So, in this tubercular granuloma, you can see the rim of lymphocytes and you can see few occasional plasma cells in the rim. So, let's again go back to our schematic diagram of a skin biopsy. We have the epidermis, we have the dermis, and the basal layer separating them. Okay, we have the different arterioles and we have venules and papillary dermal capillaries. So, these are papillary dermal capillaries. Okay. In a tubercular granulomatous tissue reaction pattern, the upper, mid, and lower dermis is filled with lymphocytic infiltrate. Okay, so you have a lymphocytic infiltrate. Okay, a lymphocytic infiltrate. Along with a background of lymphocytic infiltrate, and because it's composed of lymphocytes, which are basophilic cells, the background looks bluish. Okay, you have the tubercular granuloma. We have discussed how a tubercular granuloma looks. So you will have multiple tubercular granuloma in the upper, mid, and lower dermis. Okay. Along with that, you will have Langerhans giant cell. So look at the giant cells. Look at the Langerhans giant cells. The most of the nucleus are towards one end of the cell. They are not haphazardly or randomly placed around. Okay. And you will see those giant cells in between the inflammatory infiltrate. Okay, so the background of the dermis will be formed by a lymphocytic infiltrate, and within this infiltrate, you will see tubercular granulomas and Langerhans giant cells. Okay, so let's move forward. So these are the disorders in which you can see tubercular granulomas. Okay, so which includes tuberculosis, tuberculosis, Hansen's disease. We are not discussing leprosy in this lecture. We'll have a separate lecture on leprosy pattern. Steatobacterial granuloma, late syphilis, leishmaniasis, rosacea, perioral dermatitis, LMDF. Lupus miliaris disseminatus fascia. So these are all disorders in which you will see tuberculoid type of granulomas. What are tubercular granulomas? These are granulomas that have significant rim of lymphocytes surrounding it. The prototypic reaction is lupus vulgaris. The prototypic disorder in which you see tubercular granuloma is lupus vulgaris. In lupus vulgaris, you see epidermal atrophy. Remember, clinically also there is atrophy present. There's epidermal atrophy, there's follicular plugging. But we are more concerned about what is happening in the dermis. In the dermis, you will see tubercular granuloma in the upper and mid dermis in a background of lymphocyte infiltrate. So as we have discussed in the last slide, you have a background of lymphocytes, and within those background of lymphocytic infiltrate, you have tubercular granulomas and Langerhans type giant cell. Remember I told you that the boundaries of granulomas is fuzzy, and because of this fuzzy, they look mixed altogether, and that is known as confluent granulomas. Rarely you will see caseation. Scarring may or may not be present, and you do further staining like AFB staining or fight Farago staining to find out AFBs. Okay, so you need special staining. Now remember, in any type of granulomatous tissue reaction pattern, you need to do some kind of special staining to further characterize. For example, let's say in suppurative granulomas, you have to do special stain to find out fungal elements. Okay, or in sarcoidal granulomas, you might have to do reticulin stain to further delineate those granulomas. So in any case of granulomatous tissue reaction pattern, you need to know special stains also for individual organism. Those special stains are beyond the scope of this particular lecture, but maybe when we will discuss some kind of disorders or a specific disorders, we'll talk about those special stains. So here we have taken a we have taken a picture from McKee's Skin Pathology, page 231, and we look at the histomicrograph of lupus vulgaris. So look at the background first. Okay, background is showing lymphocytes. Okay, so it's a lymphocytic rich background. The entire dermis is filled with lymphocytes. We will not concern ourselves with the epidermal changes. Just look at the dermis. The background is filled with lymphocytes. And in between them, you will see this kind of ill-formed granulomas. Can you see that the boundaries are not that distinct? They are fuzzy. It is a bit difficult to separate granulomas from the background lymphocytic infiltrate. For example, here you can with difficulty only you can make out this kind of collection, but if you look closely, the areas of granulomas are pinker as compared to the background basophilic lymphocytes. Okay, the background lymphocytes are blue. Okay, they're more basophilic, while histiocytes are more eosinophilic. They are more pinkish. So you can see these discrete collections. Okay, here is one. Okay, so these are all collection of histiocytes in lupus vulgaris with a background of lymphocytes. Okay. Now this is a magnified version, and we are here focusing on the Langerhans type giant cell. So this is a giant cell. Can you see this large structure which has multiple nucleus? So here is a nucleus, here is a nucleus, and you can very well appreciate that a lot of different nuclei is at one end of the cell. So that is because they are Langerhans type giant cell. Okay, Langerhans giant cell. And you can easily make out the background lymphocytes. This whole area is actually a collection of histiocytes. Okay, so the collection below the line is histiocytic. It's more pinkish, and you can actually, let me just change the pen. You can see this slipper shape. Okay. Here, yeah, slipper shaped nuclei. Can you appreciate this slipper sole like nucleus of histiocytes? See, these are all slipper shaped, and it's very difficult to actually see the cell membrane. They are more confluent histiocytes. Okay, while above the line you can see majorly the lymphocytes. Let's move forward. Okay, so in the previous slide we saw what we discussed tubercular granulomas, and now we're going to discuss sarcoidal granulomas. Okay, so in sarcoidal granulomas they are discrete. That means you can easily make out they are separate. Okay, you can easily find that yes, this is a granuloma. In the previous slide, we saw that it was a bit difficult for us to actually separately see granulomas. Okay, They are discrete round to oval granulomas. Okay, round to oval granulomas, and they have a sparse lymphocytic rim. And this is a very important differentiation factor between tuberculoid and sarcoidal granulomas. In sarcoidal granulomas, the lymphocytic rim is sparse. That means it is less. You might see lymphocyte, you might not see lymphocyte, but the rim is not as prominent as you see in tuberculoid granulomas, where the lymphocytic rim is very prominent. Okay. Now, again, the granulomas are composed of epithelioid cells with multinucleated giant cells, and both type of giant cells, Langerhans giant cell and foreign body giant cells, both are seen, but majorly we see Langerhans giant cells. Now, in sarcoidal granulomas, as the name suggests, the prototypic disorder is sarcoidosis. Okay. Sarcoidosis. And in sarcoidosis, you see additional features like asteroid bodies or conchoidal bodies, which are also known as Schumann bodies, which are just crystalline particles. And these crystalline particles are admixed in the infiltrate, the inflammatory infiltrate. And you can, if you find those particles, if you find asteroid bodies along with sarcoidal granulomas, you are looking at a slide of sarcoidosis. Okay, so let's move forward and understand what is sarcoidal granulomas. Now, these sarcoidal granulomas are also known as naked granulomas. Why? Because they don't have a jacket of lymphocyte. Normal tubercular granuloma has a rim of lymphocytes. Sarcoidal granuloma doesn't have that, so they are known as naked granulomas. They have sparse periphery of lymphocytes. The papillary dermis is usually spared. Okay, and you can use special stains like reticulin stain to localize the granulomas. Okay. Now, reticulin fibers are surrounding the granulomas. So, if you stain specifically for reticulin fibers, you can easily find out these discrete looking sarcoidal granulomas. Let's again come to the schematic diagram of dermis and epidermis of a skin biopsy. And you can see that you have multiple naked granulomas. They are a collection of histoid cells, they're a collection of histiocytes, but the surrounding lymphocytic rim is not at all that prominent. Okay, and with that, in the background, we see a mixture of Langerhans giant cell. We can also see foreign body giant cell, but majorly we see Langerhans giant cell. Sarcoidal granulomas are seen in sarcoidosis, okay, sarcoidosis, Blau syndrome, reaction to foreign materials, secondary syphilis, Sézary syndrome. Now remember, in late syphilis or tertiary syphilis, you were seeing tubercular granulomas. In secondary syphilis, you see more of sarcoidal granulomas. Sézary syndrome, herpes zoster scars, systemic lymphomas. These are all disorders which are taken from Weedon's book, which shows sarcoidal granulomas. So look at this histopathology now. Okay, in this histopathological picture, you can see sarcoidal granulomas. Okay, look at this granuloma, the collection of cells. Okay, or you look at these granulomas. Can you see that you can easily identify them? So they are discrete. Okay, they are easily identifiable, and these are very large granulomas, and they are sparing the papillary dermis. Okay, here is the papillary dermis, and that is spared. These are granulomas, and they don't have that lymphocytic rim or the background lymphocytes. So that is why they are known as naked granulomas. Okay. If you look one section and we have magnified that section to look at one of the collection, one of granulomas, and these are all these are all histiocytes. Okay, and in between histiocytes, you can actually see giant cells. So this is a giant cell, this is a giant cell. Okay, now you can easily see those giant cells, and they are more of Langerhans type giant cell. But look at that, there is no periphery of lymphocytes. Just make a note of that. And here, if you can look closely, this is a Langerhans giant cell. Let me just mark it for you. Langerhans giant cell. So you can see that a cell is there, but the nucleus is at one periphery because they are Langerhans type giant cell. Let's move forward. So here we are focusing more on Langerhans giant cell. You can see that giant cell in between the histiocytic granulomas without a peripheral lymphocytic rim. You can see the nucleus is there at one end. Okay, so this is a Langerhans type giant cell which you see along with naked granulomas. So you're looking at a slide of sarcoidosis. Okay, let's move forward. Now this structure here is a asteroid body. Let me change the pen color. Yeah, asteroid body. Now, asteroid body are nothing but trapped collagen bundles. These are all collagen bundles which have been trapped inside a granuloma, okay, or components of cytoskeleton. They are predominantly vimentine in origin, but other intermediate filaments can also be there. And they are stained by phosphotungstic acid. So this could be a good quiz question, okay? A good quiz question that what substance is used to stain for asteroid bodies. They are stained by phosphotungstic acid, in which they stain darker or blackish to brownish. But on HNE, you will see these asteroid bodies. Now, why asteroid bodies? Because they look like star. Okay, aster means star, and asteroid means star-like. So here you can see that they do look like star. Okay, a star. Let's move forward. And here we are looking at Schaumann body. So this structure here is Schaumann body. Now, Schaumann bodies are shell-like calcium impregnated protein complexes. That means calcium has impregnated some protein complexes. It has, you could say, covered some protein complexes. And since calcium is the most basophilic substance, it's the darkest staining blue substance in an H&E slide. You see this kind of dark bluish, very, intensely staining basophilic substance known as Schaumann body. So this is a Schaumann body. It's a very non-specific. Asteroid body is also very non-specific finding. It's seen in other disorders like nocardiosis and different kind of other disorders. But if you are able to find these kind of structures along with naked granulomas, along with Langerhans giant cell, think of sarcoidosis. Now, can be multiple foreign material which can form sarcoidal granulomas. Remember, foreign material or foreign bodies that gets trapped inside the skin, they lead to a foreign body reaction. Okay, of I think I will not be able to write properly, but just bear with me. So they usually form foreign body reaction, but they can form sarcoidal reaction, and this substance are silica, silicon, tattoo pigments, zirconium, beryllium, zinc, acrylic, keratin, okay, cactus, wheat stubble, all of these can show sarcoidal reaction pattern. The third reaction pattern is necrobiotic or collagenolytic granulomas. Now, one thing we have to understand that necrobiotic is an older term. Okay, necrobiotic is an old term. Why? And it's a very wrong term to use because necrosis means death, and biotic means something living. But here, the structure which is undergoing degradation is collagen, and collagen is not a living substance. Okay, it's an inert non-living substance. So something which is not alive cannot undergo necrosis. Okay, so it is lysis, it is destruction of collagen. And in necrobiotic or collagenolytic granulomas, you see necrobiosis. But now the term has been replaced and we use the term collagenolytic. Okay, in collagenolytic granulomas, you see epithelioid cells, lymphocytes, occasional giant cell, and in between the granulomas, you will see areas of necrobiosis. Okay, so you see granuloma with lymphocytic rim, epithelioid cells, few occasional plasma cells, and in the center, you will see necrobiosis. Now, necrobiosis will look like amorphous pinkish area at the center of granuloma, but the necrobiosis can also be seen outside granuloma because collagen destruction is happening everywhere. Okay, so in necrobiosis, you have blurring and loss of definition of collagen bundles. Remember the lecture on dermis, in which you could easily make out a normal collagen bundle, but in necrobiosis, the collagen bundle is blurry. It's hazy. This decreased connective tissue nuclei in between the collagen bundles. This altered staining, that means the staining is also changed. This stringy mucin, the mucin gets more thread-like. Okay, there are multinucleated giant cells along with the granuloma. Just remember, if at the center you see destruction of collagen in the form of necrobiosis, it's collagenolytic granulomas. Okay, let's move forward. So collagenolytic granulomas is seen in disorders like granuloma annulare, Necrobiosis lipoidica, a necrobiotic xanthogranuloma, rheumatoid nodules, rheumatic fever nodules, reaction to foreign materials and vaccines in Crohn's disease too. Okay. Now remember I said that necrobiosis can also be seen outside granulomas. Okay. It's not that every granuloma will have a center of necrobiosis or every necrobiosis will have a granuloma around it. Okay. It can be seen outside granulomas also. So we'll just look at a slide of Granuloma annulare. Granuloma annulare is a prototypic dermatosis showing necrobiotic or collagenolytic granulomatous tissue reaction pattern. There are three histological patterns. Okay, the three histological patterns are necrobiotic or collagenolytic, interstitial or incomplete, which is the most common form, and granulomas of sarcoidal or tuberculoid type. So in the third type, you see more of sarcoidal type of granulomas along with necrobiosis, more of tubercular type of granulomas with necrobiosis, but the necrobiotic granuloma tissue reaction pattern is seen in granuloma annulare. So there in GA, there are more than one area of necrobiosis which is surrounded by histiocytes and lymphocytes in the superficial and mid-dermis. Okay, there is peripheral rim of histiocytes which may form palisaded pattern. Now, what do you mean by palisaded pattern? Palisading pattern means they form shelf-like structures. Okay, so if you are looking at a skin biopsy, okay, and here is the dermoepidermal junction, you will see collection of histiocytes like a shelf, like this, like layers, like they have settled down in layers, which is known as the palisaded pattern. And in between, you will see a necrobiotic granuloma. Okay. So this is the prototypic structures that you see in necrobiotic granuloma, along with multinucleated giant cells and perivascular infiltrative lymphocytes and histiocytes. So look at this slide. Okay, look at this slide, and you can actually easily see this. This is a granuloma here. Okay, this is a granuloma here. These are all granulomas. Can you appreciate that you have pinkish structures and the inflammatory cells? What is happening to inflammatory cells? Let me change the color. The inflammatory cells are forming shelf. Look at this. Okay. Or you look at this large shelf. So they are forming shelf. And this is known as palisading pattern. Okay. So if you see a necrobiosis along with granulomas, along with palisading inflammatory cells, think of GA. Okay. So you think of GA. Let's move forward. Let's discuss the fourth type of granulomas or suppurative or mixed cell granuloma. Okay, now why they are known as mixed cell granuloma? In a mixed cell infiltrate, you see two types of infiltrate. One is acute infiltrate, which is exemplified or which is composed of neutrophils. And second, you see chronic infiltrate, which is composed of chronic cells like lymphocytes. Now, in a granuloma, you have a layer of lymphocytes surrounding it. So lymphocytes are already present. But along with lymphocytes, if you see neutrophils or neutrophilic abscess inside a granuloma, you have mixed cell granulomas. And since you have abscess formation, because of abscess is there, we call it as suppurative or abscess forming granuloma. Okay, so the fourth type is suppurative granuloma or mixed cell granuloma. Okay. So in mixed cell granuloma, you see neutrophilic microabscess. And these microabscess can be seen in multiple layers of epidermis. Now remember, these are just microabscess, these are not granulomas. Granulomas are seen in the dermis, not in the epidermis. Okay? Let's mark here. So neutrophils and neutrophilic debris is seen along with granulomas in the dermis. So in the epidermis, you have multiple microabscess of neutrophils. In the dermis, you have granulomas and neutrophilic abscess, along with foreign body type giant cell. Okay. Now granuloma may be ill-formed because the cells are undergoing destruction, and the separate type of giant cell that you see is foreign body giant cell. How to differentiate foreign body giant cell from Langerhans type of giant cell? In Langerhans cell, the nuclei are towards one pole of the giant cell, while in foreign body they are randomly distributed inside the whole cell. Okay, let's move forward. Now these are all the disorders in which you can see suppurative. Most of the suppurative granulomas are seen in infections. Okay, they are mostly seen in infections. Infections like chromomycosis, phaeohyphomycosis, sporotrichosis, and non-tubercular mycobacterial infection, blastomycosis, coccidio, mycetoma, LGV, pyoderma gangrenosum, not an infectious disease, but a lot of neutrophilic dermatosis. Okay, so a lot of neutrophils are there, making neutrophilic granulomas. Okay, ruptured cystin follicles. If you remember the dermis slide, I've told you that follicles after undergoing destruction they can have foreign body type granulomas. They can also have suppurative granulomas. Okay. Look at the lecture on lacunar tissue reaction pattern and there I have mentioned that. Okay. So most of the infections that we see here are fungal in origin, isn't it? So whenever there is an organism which is causing infection in the skin biopsy and you see granuloma surrounding it, look closely and you'll be able to find suppuration or suppurative granulomas. If in the granuloma you are able to identify neutrophils and lymphocytes, it's a mixed cell granuloma. Okay, let's move forward. So if we want to know about few examples of suppurative or mixed cell granuloma, we divide into infectious causes and the non-infectious causes. The infectious causes include fungal infections like sporotrichosis, chromoblastomycosis, phaeohypho, and all. Okay. Infections also include bacterial infections like nocardiosis or actinomycosis, a typical mycobacterial infection, cat's cat disease, LGV. Okay. So infections have majorly fungal infections followed by bacterial infections. The non-infectious causes of mixed cell granulomas include hidradenitis suppurativa, acne, rosacea, if the cyst gets ruptured, pyoderma gangrenosum, and in fact in normal foreign body granulomas. Wherever the foreign body is formed by an organism which can undergo destruction, you will see suppurative granuloma. But if the foreign body is inert, it cannot undergo destruction, let's say a talc material or a suture material, you will see foreign body granulomas. It's not a very distinctive differentiation between these two, but more or less you can understand that if it can undergo destruction, if it's an organic material, you will see suppuration. A living material, you will see suppuration. If it's a dead material or an inert material, you will see foreign body granulomatous tissue reaction pattern. So look at this slide of sporotrichosis. Okay, let me change the pen. Yeah, this is a granuloma. Okay, this is a granuloma, and outside the granuloma, you will see majorly there are lymphocytes. So outside is lymphocytes, but in between, you can actually see neutrophilic collection. Okay, just go back and see the slide of histopathology of dermis, where we have talked about how to identify neutrophils. So these are formed by neutrophils. Okay, so you have a granuloma of histiocytes. In the center of the granuloma, you have neutrophils, and outside the granuloma, you have majorly lymphocytes. So there are two types of cells. You have acute neutrophils and chronic lymphocytes, and then it becomes a mixed cell granuloma. Okay. And if you look closely, you can actually find foreign body giant cell, but for that you need to go to higher magnification. So let's discuss foreign body granulomas. Okay. In foreign body granuloma, which is the fifth type of reaction, you see multiple foreign body giant cell. Okay. And previously we have discussed how to identify foreign body giant cell. In foreign body giant cells, you will have nuclei which are randomly placed inside the giant cell. Okay. So in the granuloma, you can actually find the foreign material. So let's say in an example of foreign body granulomas, the foreign body is talc or suture material or cotton fibers or something like that. You can see those structures inside the granulomas, and sometimes they may require polarized light. So under the action of polarized light, okay, if you have a polarizer with you while you are examining the slide, I urge you to use it and see the polarization. So under polarized light, it will appear shiny. Okay, the material, the foreign material will appear shiny or refractile. So I have a short video in subsequent slides in which I'll show how a foreign body looks under a polarized light. So in this slide, this structure is actually body parts of a tick infection. Okay, so it's a tick infection. So these are all ticks. And there's a few collection of neutrophils, so some kind of separation or pus formation is present, and surrounding that there are histiocytes and lymphocytes. So these all structures are histiocytes and lymphocytes. Okay, so this is what we see in foreign body granulomas, and if we look at higher magnification, you can easily see foreign body type giant cells. So here the material that we can see, this blackish pigment, is actually tattoo. Okay, so tattoo has gone inside, it's gone deeper, and it has led to a tattoo granuloma, which is a type of foreign body granulomatous tissue reaction pattern. And this whole collection here is actually histiocytic collection. And in between the histiocytic collection, you see a foreign material, the tattoo pigment, the color. Okay, so here also you can see tattoo pigment. Okay, so here also, I think you can appreciate the giant cells. Okay, these large cells, some of them are Langhans. For example, this is a Langhans type giant cell, but some of them are foreign body giants. And you can actually make out this granulomatous reaction pattern. And here, if you look at this video, can you appreciate, can you see this glowing thing under a polarized microscope? Let me see if I can change the, okay, look at all the glowy thing. Let me see. Just a second. Yeah, look at this area. Look at this area. Look. So under a polarized light, the foreign body can be refractile or shiny. That is how you can confirm a diagnosis of foreign body granuloma. So this here, this whole region is actually filled, it's a large granuloma, and at the granuloma, you can see refractile material under polarized light. So in foreign body granuloma, it can be because of exogenous material or endogenous material. Okay. The other type of granulomatous tissue reaction pattern includes xanthogranulomas. Okay. I'm not going into detail about xanthogranulomas. I will discuss only superficially. And then you have the final category, the miscellaneous one, which includes Mulkerson-Rosenthal, histiocytic lymphangitis, elastolytic granulomas, in which the elastin fibers is the structure inside the granulomas. Okay, interstitial granulomatous dermatitis, superantigen yield reaction. If you really want to know in detail about this, however, at residency level, these are not required. Focus more on tuberculoid, sarcoidal, suppurative, foreign body, xanthogranulomas. Okay, focus more on this. Collagenolytic, very important. Histopathology of, GA is very important. So, with that, without much further ado, I will again recommend these two books, at least at the beginner level during residency. Read the IADVL textbook of Dermatopathology and the Fundamentals of Pathology of Skin by these two books. These two books are good. And if you have interest in dermatopathology like me, you should then graduate slowly and read Weedon's or read Lever's pathology or McKay's histopathology of skin, and so that and look at the slides. Look a lot. You just go through a lot of different slides so that you can at least recognize these structures. And in the end, you collect all your findings together in a report, and then you make some sense of histopathological findings. Okay. So with that, there are some reading recommendations, but if you just go through this video lecture, you'll be easily able to understand the granulomatous tissue reaction pattern. Without much further ado, we'll just stop the lecture here. I hope you found this a bit useful. In granulomatous tissue reaction pattern, it's a bit difficult reaction pattern to understand, but it is, in my opinion, one of the easiest reaction patterns to find in a slide. Whenever you see a lot of inflammatory cells in the dermis, look for granulomas. And if you see, let's say, if you see one giant cell, look for granulomas. And a good site to look for granulomas are around the structures of the epidermis, structures of the dermis. For example, you look around vessels, you look around nerves. For example, in leprosy pattern, you should look around nerves. Look around sweat glands. Okay. Look around venules. Okay. And if you find a collection of granulomas or collection of histiocytes together, try to find giant cells. And after that, you make a final reaction of the skin biopsy shows granulomatous tissue reaction pattern. And if you can find some neutrophils, you can sign it off as mixed cell granulomatous tissue reaction pattern. So in a skin biopsy, you just diagnose the reaction pattern. And in the end, depending on what all differentials were supplied to the pathologist, it says mixed cell granulation tissue reaction pattern or sarcoidal granulomatous tissue reaction pattern consistent with sarcoidosis. So you don't diagnose sarcoidosis, you diagnose the reaction pattern and then you write consistent with this differential or that differential. Okay. So if you have any doubts or any suggestions, you can just write an email or comment just below this video and I reply to I try to reply. There are a lot of comments so it becomes difficult, but I do try to reply as soon as I can. So without much further ado, I will stop this lecture. Adios and bye bye.